Hello, my name is Love Anderson, and today I'd like to talk to you about the Breastfeeding Family Friendly Communities Initiative. I encourage you to visit our website to find out more and learn more details. The Breastfeeding Family Friendly Communities Initiative was developed by the Carolina Global Breastfeeding Institute about 7 years ago. It grew out of the work that the World Health Organization was doing around the 10 steps to successful breastfeeding and the Baby Friendly Hospital Initiative, the work that WABA was doing, and all of these initiatives to look specifically at step 10, discharge. We know that parents hear about the benefits of breastfeeding, and many of us know that breastfeeding is the healthiest choice. But many parents feel challenged and responsible for making this choice that looks easy in the pictures, but is often very difficult for the parent. We at Breastfeeding Family Friendly Communities, we know that success for the parent is about more than just one parent and one baby. We look at it from the perspective of the entire breastfeeding family and all of those individuals who live in the house with the baby, as well as thinking about how friends and family members, lactation support workers, hospitals, state agencies all work together to create this success for the parents. We know that the experience for the breastfeeding family is all surrounded in our cultural norms, our history of discrimination and racism. As a parent who lives just 45 minutes from the Carolina Global Breastfeeding Institute in the next city over, this work was being piloted in the town right beside me, but it hadn't quite made it inside of my community. I had been a teacher here in my local city and volunteered with a number of organizations, and I was currently serving as a peer-to-peer lactation support provider here in Durham. And IBCLC had approached me about this initiative, and she said, "Love, have you heard of it?" And I said, "Oh, yes, Gina. I had heard about the 10 steps of the breastfeeding family friendly community, but it was a lot of work." My support group was amazing, but when I left the support group and I went to my mall, to my grocery store, my little ones and I weren't experiencing the kind of support that I was looking for. As well as inside the support group, the families that were attending the meetings didn't look like my community. They didn't look like my friends, the people I saw at the park, my grocery store, the high school where I worked. And Gina, she twisted my arm and got me thinking about what it would look like if every infant in my community experienced first food equity. If every infant, every baby, every future adult who's going to grow up with my children had their first needs met around food and hopefully maybe a few more of their first needs. And we began to partner with Breastfeeding Family Friendly Communities, and they invited me to join the board, as well as they supported all of our work in Durham. And we here in Durham began to look at the 10 steps around government. How could we work with government to create a more welcoming atmosphere? How could we work with healthcare leaderships to make sure that pregnant families were informed? How could we partner with our employers, our organizations, our for-profit and our nonprofit organizations, so that not just employees knew about lactation and felt supported, but businesses felt supported too? How could we break down the World Health Organization's code of marketing so that it made sense and was applicable and useful in our local community? How could we connect with childcare, infant care, preschools, elementary schools, high schools, and universities so that breastfeeding was normalized and taught to our future students and teachers? And all of our community was working together so that every family experienced the ability to feed their child however they chose to feed their child. About over the course of this journey and 2 years of us doing this work as volunteers, we began to partner with the Durham County Health Department and Aubrey Delaney.
Hi, thanks, Love. My name is Aubrey Delaney. I work at the Durham County Department of Public Health. One of the things I've been working on is recruiting businesses to become breastfeeding friendly and finding success in making personal appeals as much as possible. So reaching out to places that I frequent, so I'm asking as a customer and or showing up in person with a flyer with an easy to scan QR code has been definitely helping me sign businesses up to get certified as breastfeeding friendly. I've also been working to make our local government breastfeeding friendly. I wrote and pushed forward an employee and guest lactation policy at the health department and are now working on a county-wide policy. The county one's proving to be a bit trickier given the variety of different jobs and different departments and different employees that we have and the buy-in that's needed from a bunch of different partners. But I'm working on it. It's going to happen. Along with these policies come employee and staff training to make sure that everyone is aware of the policy and what it means to our breastfeeding employees and guests. We want to make sure that not only do we have a policy, but that our employees know about it and know how to support breastfeeding families. We have a Mama lactation pod, new signage up around the health department, and we're working on more changes. The health department's also been focusing on technical trainings for our clinical staff to ensure that they're able to provide the best breastfeeding support to our pregnant and postpartum patients. All right, let's hear from Bernadette.
Hi, my name is Bernadette Green. I work with the health department as a community health worker. I'm also a part of the Breastfeed Durham and Fatherhood of Durham. I have 5 children, which I have breastfed every last 5 of them until 2. As a community health worker, I am out in the community doing outreach to Spanish speaking and English speaking families by just getting out information and of the different resources that Durham has for us as a community. I also, with the Breastfeeder Durham, as far as working, trying to get information out, sharing information to parents that are moms that are breastfeeding to let them know that it's very important to breastfeed, as well as to get dads involved in the families. I also, with the Fatherhood of Durham, for as I help the dads get information to get in jobs and education to better succeed and to help their family out as well. I'm also called in the community as the resource lady. So this is what I do for the department of the health department of Durham in my community.
Hi, my name is Alicia Bailey. I'm an IBCLC and currently serving as the WIC and Breastfeeding Programs Manager for Piedmont Health Services. Piedmont Health is a federally qualified health center providing a medical home for 50,000 people in 4 central North Carolina counties. We have partnered with Breastfeeding Friendly Communities, the North Carolina Breastfeeding Coalition, and the Embrace Project on several initiatives within Orange and Chatham counties in the past year. We're working to bring all 10 of our community health centers in line with the Mother Baby Friendly Outpatient Healthcare Clinic Award. This will allow us to provide comprehensive evidence-based lactation support to all of our perinatal and pediatric patients. We've developed breastfeeding policies that create supportive spaces for our staff, patients, and visitors, and we have dedicated lactation spaces in each of our sites. We're working with our community partners to identify and address lactation support gaps by creating a network of providers and services and a warm chain of support between outpatient clinics, local hospitals, community organizations, and childcare centers. Until recently, our Chatham residents had to travel out of county in order to give birth. So just under a year ago, a maternity center opened in our small rural Chatham County Hospital, providing an in-county birthing location for the first time in 30 years. We partnered with the Chatham Hospital to bring one of our IBCLCs in as part of the team and to provide on-site lactation support and WIC enrollment services. And they just celebrated their 100th birth. Back to you, Love.
So we ask you, is this something that's the right fit for your city, your town, your community? We encourage each one of you to review our self-assessment and take the parts that work for you, and even feel free to leave the rest behind. If becoming a breastfeeding family-friendly community is the right fit for your community, we encourage you to reach out to ask questions. We know that we're all juggling a complicated life with a lot of needs, and we encourage you to feel free to send us an email or visit our website. And our website is breastfeedingcommunities.org. Thank you.